Okay, so I got 2 points on that. The first is this, the testimony from the former government doctor who says that he lost a key post last month after opposing the president's push to use an unproven drug to treat coronavirus. Rick Bright, who is in charge of the federal agency, Ron, that develops vaccines, told House lawmakers yesterday there was no plan at the start of the outbreak and that there is still no plan today. Let's take a listen.
Our window of opportunity is closing. If we fail to improve our response now, based on science, I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history. First and foremost, we need to be truthful with the American people. Americans deserve the truth. The truth must be based on science. We have the world's greatest scientists. Let us lead. Let us speak without fear of retribution. Our nation was not as prepared as we should have been, as we could have been. Some scientists raised early warning signals that were overlooked, and pages from our pandemic playbook were ignored by some in leadership. I believe with proper leadership and collaboration across government, with the best science leading the way, we can devise a comprehensive strategy. The time is running out because the virus is still spreading everywhere. People are getting restless to leave their homes.
When you look at the first 4 months of this year, would you describe the government's and the administration's response as a success or a failure?
I believe we could have done better. I believe there are critical steps that we did not take in time.
Do you believe if your suggestions were implemented, lives would have been saved and the severity of the pandemic might have been lessened?
I believe lives would have been saved if we had proper medical protective equipment for our healthcare workers. Yes.
So people died because you weren't listened to?
People died because they didn't have appropriate protective equipment to save their lives and protect them from getting infected.
There was a visit to the CDC on March 6th, and at that visit, the administration said, anybody who wants a test will get a test. Was that true then?
There still are not enough tests.
So even this week, as we're being told, anybody who wants a test can have a test. Is that true in the United States of America?
No.
It's just painful. Secretary Azar Ron said that all of the things he was complaining about in his testimony had been met by now, all those benchmarks, and the president called him disgruntled. Your reaction?
Well, I know Dr. Bright a little bit. I worked with him on the Ebola response. He's apolitical. He's a professional. He cares only about the science and about promoting vaccines and other therapeutics, other drugs that could help fight this disease. And, the question that the Trump administration still hasn't really answered is why was he removed from this post? If it wasn't for the reasons that Dr. Bright says, which is that he opposed the politicization of science, that he opposed the White House's plan to shove hydroxy down people's throats, even though it wasn't proven, he wasn't fired because he made all these warnings about a lack of protective gear, well, then why was he fired? I mean, he's disgruntled now because he was removed from his job. I understand that. The question is, why was he removed? We really haven't heard a good answer on that. His warnings, whether he was removed or not, look, his warnings are crystal clear and seem obvious to all people. And, the last point you showed, him talking about the fact that notwithstanding the president saying on March the 6th, everyone who wants a test can get a test, we still have people in all parts of the country, in all sectors, saying that they want to be tested, they can't get tested, they need to be tested, they can't get tested. And so I think that part of the testimony speaks for itself.
So, Ron
also Rick Bright. I'm sorry. Go ahead.
Go ahead, Willie. You take it.
I was just going to say he also poured some cold water on some of the optimism around a vaccine. The president's talking about having something by the end of the year. Other doctors are saying, oh, maybe by the beginning of next year. He said even that 12 to 18-month window may be too optimistic. He also added the window is closing to address this pandemic. Do you agree with that the window is closing to address the pandemic? And what does that mean exactly? If the window closes, then what?
Yeah, I think what Dr. Bright is talking about is, obviously, it's too late to save the 80,000 plus lives we've already lost. And that forever will be something we should look at and say, what went wrong with that? But I think what he's saying is this: we still don't have enough tests. We still don't have enough protective gear. We still don't have enough preparation. And as Dr. Jha just discussed, we still don't really have meaningful guidelines from the CDC on reopening. And yet we're about to proceed all over this country with reopening this month. And the window that's closing is the window to get ready for the resurgence of cases that will come in late summer or early fall. And the problem with that is, we saw this way back in 1918 with the Spanish flu. It turned out that the second wave of the Spanish flu was worse than the first wave. Now, we don't know if that'll be true here or not, but we do know that if this disease hits hard, not in spring like it has now, but in fall or winter, when hospitals are already filled with flu cases, it's going to be a double whammy for our country and for our healthcare system. And we need to get ready for that now. I think that's what Dr. Bright's referring to.
So, Ron, given the fact that you were involved and knew well of an office that was set up, a team that was in place, a playbook that went in depth about emerging respiratory viruses, including the coronavirus, and we have up to 90,000 dead to this day, and a president who seems to be focused on rage tweeting and on conspiracy theories about Joe that are cruel to the people that he talks about. And now he appears to be going after President Obama during this difficult time for the country, difficult to say the least. I guess I would ask, in terms of helping people understand how safe they are, to understand the reality of the leadership they have, how would you characterize our response so far? Negligence, avoidance, criminal, just a severe lack of ability to process? How would you characterize the way this White House and this president is responding to this pandemic?
Well, I think it's been focused on all the wrong things. I think that there's been this obsession with trying to protect the level of the stock market, and that's really what's driven the president's reaction to this. It's why he spent all of January and February denying the existence of the virus, or denying that it was going to be serious, or saying it was going to be under control. It's why he sent Larry Kudlow on TV to talk about it in late February, as opposed to Tony Fauci. Okay, so I think there's been an effort to try to protect the stock market from the fall that came. And the problem with that, Mika, is that not only did the president really deny this was happening, but his denials really punished the experts who spoke up in his own administration. Dr. Nancy Messonnier, a career official at the Centers for Disease Control, issued a stark warning in late February about what was coming. And according to published reports, the president called up Secretary Azar afterwards and said, "You need to fire her. Her advice has been shunted to the side. She's the head official on respiratory disease at the Center for Diseases Control. She's been shunted to the side during this whole thing." So that sent a signal to the experts: don't speak up. People like Dr. Bright, who spoke up. So there was a chance here in January and February to do something about it. The president really kind of rejected that, denied that. And I think that's one of the things that set us behind. Now, we're still, I'd say, we're still on that plan to some extent. I mean, the president still kind of refuses to fully embrace masks. Indeed, even as scientists race to get a vaccine, the president said the other day, "I'm not sure I'll take it when it's available," which also inflames the anti-vaccine sentiment in this country that we're going to have to tame if, when we get a vaccine, we're going to have people take that vaccine. So I think we've seen just a failure of leadership from start to finish here. And that's not just a backward-looking statement. That plagues our response right now.
Ron Klain, thank you very much. And just a note to Donald Trump before you tweet and undermine what Ron was saying about your denial in January and February. Just keep in mind your quotes are there for everyone to see. In January, you said it was totally under control. January 24th, you thanked China for everything. On the 30th, you said you're working closely with China, and you thanked them again and said it was going to be a good ending for the United States of America. February 23rd, you said we have it very much under control in this country. That is a complete denial of what is going on today with 90,000 dead. February 26th, oh, when you have 15 people and the 15 within a couple of days is going to go down to 0, that's a pretty good job we've done. Nope. Not a good job. It's not 15 people. We're close to 90,000 dead and many more to come. February 27th, you said it's going to disappear like a miracle. It will disappear. And March 7th, no, I'm not concerned at all. No, we've done a great job with it. Backing up Ron Klain's point that the president himself, with his own words, denied and rejected the reality of this virus, which is ravaging this country. Willie?
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.